My name is Courtney Riles. I am the Community Engagement Coordinator with One Roof. And I do have a little bit about One Roof incorporated into my presentation, but just for short, One Roof is a HUD-funded agency that basically collaborates with many members and organizations within our continuum of care across Jefferson, Shelby, and St. Clair counties. We get everyone in a room to talk about homelessness, to facilitate conversations, to fill gaps in services where needed. And so we've been on this mission for, I want to say, it's been closer to 40 years. A lot of people don't know that we've been around for quite a long time. But I'm just here to share some information with you about homelessness in general, a little bit of how our organization works, and how you can get involved as well, how to interact with folks, and any other questions you may have. And also, if you have a question during, you don't have to wait till the end. I like questions during, so stop me at any point. Okay, so we'll start with some literal definitions. Homelessness can be defined by has been defined by different organizations, mostly federal, in different capacities. We are a HUD-funded organization, so we define homelessness mostly in literal. So that means that people that you're seeing outside, under bridges, in their cars, those people fall under a literal homeless definition. So it's a place not meant for human habitation. So if you see a person sleeping somewhere where they should not be sleeping, or it's not safe to sleep, that's what we consider literal homelessness, and that's mostly the population of people that we serve. Additionally, we are very big on preventing homelessness. So people who are at risk, who are like staying in a place where they may be about to be evicted, or they're unstably housed, mostly youth-age people who may be couch surfing, those folks are at risk. So we have two main definitions. There are some other definitions that kind of get off into the weeds, but for most of the people that probably would be a part of your congregation or people you would interact with, they probably are at risk and or literally homeless. And literally homeless also includes folks in emergency shelter. So those are your pathways, your Salvation Armies, Firehouse, those are our emergency shelters. So when we talk about homelessness, we oftentimes think that people's personal, issues are the cause of their homelessness. At One Group, we understand that homelessness is not a one-size-fits-all issue. And most of the time when people are experiencing homelessness, it's not just one thing. Oftentimes, generational poverty, systemic racism, the lack of investment within our communities where money is placed to keep people from falling all the way down is the reasons why we have homelessness. We also have a very big housing shortage, not only in Birmingham, in our metro area, but across the country. I do have this chart here, just so I can kind of explain that to you about what I mean by affordable housing shortage. Every state is assigned what we would call a housing wage. And in Alabama, for what HUD defines as reasonable to pay for a 2-bedroom, a person would need to make at least $20.61. I would argue, from my personal opinion, that it's way more than that if you want to stay somewhere where you feel safe. But most of our folks, a lot of times, aren't even making $20.61. And so this is just to get you to understand that even if a person has all the things that they need, sometimes the barrier is the housing itself and how they can afford it. Generational poverty as well is a really big one. That's hard to escape. There's a lot of barriers that come, with living in poverty, and oftentimes it's over generations. Does anybody have any questions about that? Yes, ma'am.
You said $20.61. You mean an hour?
Mm-hmm.
Okay.
Yes, ma'am.
Okay, I'm just making sure. Okay.
And so with this, this is from an out of reach report. You can find it for every state. They also have it to where you can shift through it and go county for county. I want to say Jefferson County might be 24 now. So it's up there. And it's harder. So what happens usually with the supply is that the more people, there might be more people that need the lower income housing, but there are people who are competing with them that should have other housing options. So it's like this Hunger Games type thing where people are just competing for housing because not all of the housing that's available is safe to live in. Some of it's abandoned. You know, there's a lot of things that go into trying to rehabilitate a house. So there's a lot of barriers with that as well. A lot of times people think personal barriers are the cause of homelessness, and I like to distinguish between personal barriers and system failings. Personal barriers would be, I have a mental health condition that I need treatment for and it causes me to not be able to keep a job. Job loss, sudden job loss specifically. Eviction, things sometimes people can't control, domestic violence, substance use disorder. But these aren't necessarily causes of homelessness, but they can contribute and exacerbate them. So I like to use my personal experience. I have a grandmother that has a schizoaffective disorder. She's never experienced homelessness. She has a support system and people around her who could get her the help she needs. So though she has that mental health barrier, and though it has been very hard to treat over years, she's never actually fell into homelessness because there was a support structure around her, though on a micro scale. But we should have that for all individuals. So that's the example I like to use. Does that example make sense? So go into a little bit about One Group. Like I said, we are a coordinating agency, and so we are part of this larger continuum network. And I believe we started as a working group in like the early 80s when homelessness in our country was started to become more visible. You have people like Jimmy Hill Mission, some of our housing authorities coming together to kind of try to put boots on the ground to figure out what they needed to do to respond, because it was becoming a large spread issue, not only here but across the country. Around I want to say 91 is when HUD developed these continuum of care programs, and that's where One Group became an actual organization. The mission of One Group is that we seek to make sure people have an adequate and safe place to stay, all community members. We believe that everyone is deserving of that, and it's not necessarily tied to your worth, or everybody deserves that. That's our vision for all of our community members within Jefferson, Shelby, and St. Clair County. Our mission is to equip and empower our community to not only prevent, but to end homelessness as we know it, and we do that through advocacy, education, and the coordination of services. And so a lot of times people confuse us with the actual continuum of care, but we are part of that structure, and we facilitate, and we are the leader of that organization, or that coalition, but we are not the continuum of care ourselves. The continuum of care generally is made up of partners who are funded by HUD, and within that, we're placing people in like a streamline so people can end their homelessness as quick as possible. So you have not only emergency shelters, you may have housing providers, landlords, the medical system, places like JBS. All these people play a role. Maybe their mission isn't just homelessness, but on the journey to end homelessness, their services are needed. And so we work with 68 partners at this time, all of which we have, varying degrees of relationship with, but we convene and connect to basically offer people services in a streamlined fashion. And so, One Group, our role is not only to facilitate this collaboration, we coordinate the efforts, the conversations, events, things like that, but we also oversee a lot of compliance. A lot of people don't know that about us, is that when HUD gives you money, you have to make sure you're in compliance. The partners that we serve as a conduit for that federal funding, we have to make sure that they're using the government's money correctly and in a way that is going to keep them funded. And so We make sure they have standards of care. Right now, we're working on making sure our standards of care across different needs and, I guess you could say, sub areas are aligned across our continuum. So right now we're working on street outreach standards of care. So if you have a street outreach program in our community, it has to meet these checkpoints in order for it to be classified as a street outreach program. We're doing it for coordinated entry, case management, and all the things. So if you go to this organization and they're within our continuum, you're getting the same service across the board. There's not gonna be a gap in how the quality of care. Additionally, we do a lot of advocacy and education. So it's going out and speaking to civic groups and communities. We have a lot of initiatives around youth homelessness as well. So that's like our behind, what is it called? Dignity Without Doors, which was formerly Cardboard Connect, where kids come in and they go through a homeless simulation and they're learning about homelessness and they're being met with barriers to kind of invoke empathy and understanding on how hard it is to go from point A to point B when you're under-resourced. Additionally, one of the largest things that we do is we manage a homeless management information system. And so that helps us to understand where our community is in ending homelessness. So it's a lot of numbers, a lot of 2026, you were here, 2028, we're here. What happened during those 2 years to say that we were going up in homelessness or going down? What services decreased? Who was doing what gaps can we fill to make sure that this number is decreasing over time? So we do a lot of data management as well. And so how most people know One Roof is that we operate coordinated entry. We operate, coordinated entry is a broad program that is HUD funded, but it is a program meant to get our most vulnerable population from homelessness to housed, as quickly as possible. And so we do that through coordinated entry assessments. Those assessments are done with people who are not only literally homeless, but as a continuum of care, we found that our most vulnerable are oftentimes youth age people, 18 to 24, families with children, veterans, and folks who are chronically homeless. So that might be a lot of people that you may see around in the downtown area. They may have different levels of disabilities, whether they're mental, physical, and sometimes intellectual disabilities. Those are the people, that's probably one of our largest subpopulations, is folks with a disability. We have client care specialists and street outreach workers who work to basically engage people, build rapport, and connect them to varying resources, even outside of the housing referrals that we do. I did speak a little bit about our data. Last year, we counted, during our point in time count, we counted 810 people that were experiencing homelessness. And that included people that were living in our emergency shelters and also people that are sleeping in a place not meant for habitation. Most of those people were single adults. 33 were like child and adult households. And then you have, it says one child, I don't know how they count that, but like there's one child only household. And then you have 44 youth, 54 veterans, and 129 of those were chronically homeless folks. And so we get a lot of questions around why it takes so much time to get people from homeless to housed. And so of course, there's housing demand for housing that is affordable for the people, especially folks who are on disability. Oftentimes, disability is probably no more than like, what, $1,200 at most? And so that might take somebody's rent, And so trying to connect them to housing that is appropriate for them, that they can afford and maintain, is difficult. It would be difficult without us, it would be difficult with us, because this is where we are as a country. But also there are nonprofit limitations Housing programs only have the capacity for so many people in a program at a time. So if Firehouse only has slots for 10 people, but we have 20 people on the wait list, someone's gonna have to wait. Additionally to that, not only the wait list, each person has their own barriers. Like they have to go here for IDs. They may be from Florida, but they're in Alabama. So we have to get some type of resource to get them their information from Florida to come back up here. And by the time that they get that information, there may be a gap in between how long they had in the program. And so there's a lot of sometimes back and forth. There are people who come through more than once to get served. And that's not something that a nonprofit themselves can change. There's just a lot of barriers that people, experience. Transportation can be a barrier as well. Limited units. Is there anything that you think that I'm maybe missing with that? Sorry to put you on the spot.
Oh, no, you're good. I was actually thinking specifically, one of the biggest barriers that, to your point about IDs, we had to have individuals come in who are like, I've got to get an out-of-state birth certificate. And that might take months. And if they come up for a referral in that time, they can't fulfill the referral for a housing situation unless they have the birth certificate.
So, this is my faith in action section of what we would love to see some of our faith community, respond and help us, because we have a lot of gaps to fill. And people, we work a lot of individualized, but one group is really trying to get people to collaborate and get on one accord. And so some of the things that I think would be impactful for us as a community would be, strategically volunteering. So that's joining initiatives, such as our point in time count, where your congregation could just see what it's like to even engage on a day-to-day basis with folks who are experiencing homelessness, and just kind of see what initiatives are being done. Point in time is a very big event for not only one group, but for continuum of care across our country. Those numbers go back to HUD, and that informs how we get funded. So the more boots we have on the ground for that, the better our data will be. And so that's a way to get involved. As far as tangible, we know we have a lot of faith-based communities who want to help financially. And so some of those, the IDs, helping to get those, because they aren't free. Birth certificate costs money, Social Security part is free, but you only get up to 10 your whole lifetime. Even transportation, bus passes, things that, we can say, hey, we're pulling out the collection plate this Sunday, get what what you can, and we support this particular initiative to get someone, to alleviate a barrier for someone. That would be very impactful. Also, space. I think of Faith Chapel and their care center, but that's a larger operation. But even a space like this where, okay, once every quarter we have case management or an outreach worker come in and talk to some of our people who may be experiencing homelessness so that they can get coordinated to care, that would be very impactful as well. Even if it's not a large scale event, I'm not thinking Project Homeless Connect, that would be a lot. But also even within people outside, because when I walked in, I saw a lot of people who may be experiencing homelessness, but just creating a safe, judgment-free environment. There are people just like us. You don't know what these people dealt with before you met them, before they became, outside. They can be just, we are all similar. So just creating that space where people can feel like they can share themselves and not be judged is very beneficial. I think conversations where you're, looking people in their eyes, not being aware of your body language and how tensed up you may be, does a lot for our population in easing their anxieties around what they may consider regular folk. It does a lot. It also helps within maybe an infrastructure like this to have a designated person who is very familiar with the continuum of care with one group, so that if a person is coming in to the church for help, you know exactly who to go to at one room, and y'all have like a one-on-one relationship where you say, well, we have this person and we wanna connect them to this care, or we wanna connect them to this. Having a person that someone can go to within your walls would be very beneficial to help streamline as much as possible as well. Also, advocacy. So supporting efforts to increase affordable housing and to improve access to services addresses the root causes. So just being more open about that, and informed on who's doing what. I know for us, we are very involved with the Low Income Housing Coalition, and they are a statewide organization that has been fighting to fund a trust fund for all Alabamians who may need housing assistance of any kind. So if they're about to lose their house, they're about to, rent, and it's specifically for rural communities are their priority, but everybody would benefit from that. We have it in our state budget, but it's never been funded. And we got really close like 2 years ago, but just being aware that there are people advocating for that, and that you can, project their voices and what they're advocating for, and educate yourselves and people that you come into contact with as well. Also just reducing stigma in our language and with our congregations as well. So understanding how language impacts people, and I'm sure, I get the vibe that we understand language and stigma here, but sometimes people don't. We like to use person first language, so people are experiencing homelessness. We don't say things like hobo or, we don't use language like that. So just being conscious of the language that you're using will help a lot. And so I'm gonna open it up to questions. This is our contact information. If you ever want to connect people to coordinated entry.